We're in Klamath County Administration Building with Klamath County Commissioners and a crowd. Doing a mic check. Well,
no. Yes, I do know it. The camera is recording. And you're posted afterwards.
When's the retirement date?
What's that?
No, it's really silent. It'll be quiet because we're.
Yeah, for that. When's the retirement date? Oh, we still have lots of time. Shoot, that's like years from now. There we go. Where are you retiring from?
Most every evening I retire.
I think that's regularly.
All right, I think we're good to go. Good afternoon, everyone. I'm Commissioner Kelley Minty Morris, Klamath County Board Chair, here with my colleagues on the board, Commissioner Donnie Boyd, Commissioner Derek Groot. We also have our emergency manager, Brandon Fowler, as well as several of our staffers and leadership from Klamath County Public Health, who you'll hear from shortly. In the last 3 weeks, Klamath County Public Health has been working with our community partners to ensure a robust and effective response if and when the coronavirus became present in Klamath County. As we now know today, that day has come, and so our leadership at Klamath County Public Health and some of our community providers will be providing information in an informational format starting now. First up is our Director of Public Health, Jennifer Little.
Good afternoon. We have invited you here today to announce that Klamath County has had its first presumptive novel coronavirus case, also known as COVID-19. Public Health understands that people are concerned about COVID-19 and is committed to sharing the latest information with our community so you can know how best to protect yourself, your family, and our community. This case is directly related to travel exposure. It is not a case of community transmission. Public Health values the rights of community members to enjoy complete confidentiality regarding their medical information. So no identifiable information will be released about any Klamath County presumptive cases. In the last 3 weeks, Klamath County Public Health has worked with our community partners to ensure a robust and effective response if and when coronavirus became present in Klamath County. This includes working directly with our schools, our clinicians, and numerous agencies to ensure coordination and communication well in advance of a presumptive case announcement. As soon as the notification of a presumptive case was received, Public Health began working to identify all close contacts and made proper notification to include risk assessment. Contact investigation allows Public Health to ensure that those at risk are monitored for development of any signs or symptoms. Contacts are monitored for 14 days following their last known exposure and are cooperating fully at this time. There is no identified risk to the greater community in Klamath County, and there is no community spread at this time. As testing becomes more widely available, we anticipate the identification of additional cases. To prioritize response for contact investigation and other measures for community protection, Public Health will not hold press conferences for future presumptive cases. Timely information about the status of cases in Klamath County will be provided on the Public Health Coronavirus Update page. Klamath County Public Health has activated its incident management team to have dedicated staff and resources to this response. We continue to work with Oregon Health Authority, our healthcare system, and community partners. Now I'll turn it over to our health officer, Dr. Warren.
So COVID-19 is a new disease. We really don't know a lot about it at this point. We're learning more every day. The CDC publishes updates of what they've learned, and we react to that and go with what they're saying. We don't know how it spreads exactly. We have ideas and some confirmation. The severity of the illness that it causes and how severe that can be and how often is still being updated as we get new information. And to what extent it may spread in the United States is really not known yet. We do know that older people and those who have underlying health conditions are at greater risk for catching the virus and having a more severe form of the virus. The virus at this time is thought to be spread from person to person through close personal contact. And what's meant by that is people that are less than 6 feet apart and have prolonged contact of an hour or more. I'd like to say and reiterate what Jennifer said, that this case is related to travel. It is not a case of community transmission. At this point, there is no reason to be alarmed, and the community is encouraged to continue practices that reduce exposure to germs. And we're going to go over some of that. This would include washing your hands frequently, and when you wash them, making sure that you wash them for 20 seconds with soap and water, or to use an alcohol-based hand rub. This will remove germs from your hands, and in other words, wash like you just chopped up a jalapeno and you don't want to touch your eyes, and especially if you wear contacts after it. Make sure if you are coughing or sneezing that you cover your mouth and your nose with a flexed elbow or tissue, and that you throw away that tissue immediately and that you wash your hands right afterwards. In this way, you'll protect others from any germs that might come from any airborne sneezing, coughing. Practice social distancing if possible. So if someone is coughing and sneezing, try and maintain at least 6 feet of distance between yourself and that person. Avoid touching your eyes, nose, or mouth unless you've washed your hands first. That's because all of us touch surfaces, and then we go and touch our face and eyes, and we do not know how long this virus lives on a surface. So that would be best. Also, if you have a fever, a cough, or any difficulty breathing, you should seek medical care. Call ahead to schedule an appointment, and so that you can have minimization of exposure to other people. Also, follow any guidance that your physician or healthcare provider or public health advisories. If you're sick, stay home. Don't go out in public. Have someone else do your shopping. I'm going to turn this over to Dr. Grant Niskanen from Sky Lakes.
I am Grant Niskanen, Vice President of Medical Affairs at Sky Lakes Medical Center. The Sky Lakes Medical Center system is working to ensure the community that can obtain any services that are necessary. Our team has been planning to ensure the proper precautions are in place to protect the health and safety of our community, patients, and employees. We are participating in coordinated community planning efforts to follow the most up-to-date guidance as provided by the CDC and the Oregon Health Authority to ensure minimal risk of exposure. Clients can be assured that their health and safety at any Sky Lakes facility is a priority. I would also like to add the key to stopping the spread is to avoid contact with infected persons. 80% of this illness is typically mild to moderate, which allows people out in the community, but is we need to emphasize that anyone with illness, cold-like, flu-like symptoms need to stay home until they're completely asymptomatic, and that will be the best way to stop the spread. Now I'll open up the floor to questions with Dr. Warren. Thank you.
Anyone have questions?
Dr. Warren, I see we do have our school superintendents here and from KCC. Any special effort that is being made in our public schools to go ahead and help to prevent this spread? Any potential for closure if we do have a problem hitting any of the schools?
At the moment, there's no recommendation for closure. It is not in the community at this time. The recommendation would be if people are sick, whether that is people going to school, the staff at the school, that they stay home and using proper hand washing techniques.
Another kind of a different one here too, but differentiating between the flu and coronavirus, is there any, what are kind of the differences in these that we're seeing?
They overlap, the symptoms overlap in a lot of ways, and the presentation is frequently the same. One of the things that seems to be more apparent is flu is more easily spread before there are symptoms. Coronavirus can be spread before there are symptoms, but it is much less likely. It's much more contagious once the symptoms appear.
You mentioned this person is known to have traveled. Do they self-report? Do they come in with symptoms?
That we're not going to give that information at this time. We really want to protect the identity and the privacy of the people who are diagnosed, so that makes our ability to then do contact tracing and be able to isolate people so that they're not spreading the infection better. But it was a travel-related case.
So they knew they might have some exposure, even if they weren't showing symptoms?
They were told that they might have exposure. But any other identifying information, we really would rather not do that, because as we get more cases in the community and we need to track down people, we need to respect their privacy and our ability to be able to identify contacts and keep the community safe.
Sure. Are there other cases under testing sent off at this point?
I also can't comment on that. Once again, that would be not, in not keeping people's privacy as we would like to.
That's okay. That's just a simple
Yeah.
yes or no.
So the testing so far has been done through the state. And as we go forward, though, there are private labs that are starting to do testing, and the public health department may not know that someone is being tested. It will be reported if it comes back positive, but we may not actually know all the people that are being tested.
Well, and those results would come back through the county?
The ones that are going through private labs would go back to the ordering provider. The ones that are sent through the state that are approved by them come back to Klamath County.
Yeah. And I just asked these questions in the doctor's section, but the best way is to avoid exposure, but people can have it and not know it. So he might have it now, and I might be getting it, and I don't know. So how do I red flag?
You really, like I said, most people that are contagious at this point in time, we believe, are showing symptoms. And if you're showing symptoms, you should stay home.
That kind of leads into my question here. If you have concerns, oh my gosh, I've got a raspy throat, all this, go to your doctor's office or call?
Call your doctor's office and they will direct you as to what they would like you to do. Most of the offices in town are providing masks to people who are symptomatic as they walk in the door.
Your comment about using private testing, which the OHA made a reference to this morning as well, and stepping counties through that. Is that just out of need because the state has a capacity?
The state has capacity to test 40 people a day, and that is not, we need to have broader capacity, and so other routes are being developed. Other questions?
Can you tell us anything about the condition of the person, or if they're hospitalized?
No, once again, to maintain their privacy, we are not releasing any of that information.
So is this a completely different flu strain, virus strain, or is this a seasonal flu? We're hearing that, a lot of comments and questions about that on social media.
It is a new virus. It is not influenza. It is something called coronavirus. There are other coronaviruses, but this particular strain of coronavirus is new.
Without revealing anything that might reveal an identity, can you give just an idea of time frame of how, whether in this case or as you're learning more about coronavirus, the time frame that people might seem well and might be exposing people?
There have been reports of people showing symptoms within a couple of days, and there have been people that have had more prolonged time to have the symptoms show up. So it varies. What that exact time range is, we don't know yet.
Another thing that I hear people say when we talk about a presumptive case, then people take that word presumptive to mean that it's not real until the CDC confirms it type of thing. So can you kind of talk about what maybe officials do in the meantime before CDC confirms it?
Yes, if we have what we call a presumptive case, that means that they had a positive result at this point from our state lab, and at that point we treat them as though they have coronavirus. That their samples are sent off to the CDC, who then do confirmatory testing. But at this point, anyone who came back with a presumptive case is being treated as though they have it.
Maybe this question for you might be for a representative from Sky Lakes, but what is the process that somebody may be going through if they're showing these signs and they've tested positive? What are they, obviously being isolated, but what is that process?
So that would be different. If someone does not need to be hospitalized because they are not ill enough to require hospital services, they are staying at home. That's what that means. Dr. Niskanen could address what happens if someone is in the hospital and tests positive. That would be a different scenario, obviously. Would you like him to?
So if someone comes into the emergency room and they have a flu-like illness, they're immediately placed into isolation. We have our personnel, we minimize the contact with the patient, but they have personal protection equipment to wear. We'll test the person first for the flu. If it's negative, that then raises our suspicion there's something else going on. We have a second test, a viral panel that will be run called a biofire. And then if that's negative, and that will have the adenoviruses and the other typical viruses that we see in the community. If that's negative, that rises our suspicion even more. We'll then contact the public health department and request the COVID testing. And the patient is sick enough, they'll go to the floor, they'll be in isolation. Again, protective equipment for the staff that's directly involved in the care of that patient.
I wondered about that. What sort of facility or facility inside your facility you have set up to contain it and protect your staff at the same time?
We have negative pressure rooms where the air, when you open the door, it doesn't go out. The air comes in and is vented out. And it's not going through the rest of the hospital ventilation system. It's directly going outside.
Regular hospital wear adequate, or do you need hazmat?
No, we have what they're called PAPRs, P-A-P-R, which is they're the space-like suits that have a white outside, footwear as well, and then a hood. Those are reusable and they can be cleaned in between to a certain amount of time. We also have something called an N95 mask that is a much higher grade mask than the typical surgical mask, and again used for people that are involved in direct care with the patient.
Yeah, we've heard some shortages of masks. Like your hospital's in good shape. Got your order in?
We're in okay shape at this point, but yes, there are a number of hospitals that are short and even some clinics that are in dire straits at this point. The state does have some extra supply and they're being doled out as necessary. And we're being very conservative, but again, we're going to protect our staff as best as possible.
So you can handle more cases?
Yes.
Do you expect more?
This is a novel virus for us. Because the mild to moderate illness, it is more easily spread. If you look at what's happened up in the Seattle area, I do expect some more cases.
I know we do have patient confidentiality here as well, if you can't answer this, I understand, but is there any idea of how many people may have been in contact with this person before they determined them?
I can't answer that, but that all contacts have been talked to and proper precautions are being taken. Other questions?
I have one quick question. You mentioned about sort of public health safety center activating, or did I misinterpret that? No?
It's the incident management team, and so it's the public health team with the support of our county officials.
Okay, and what does that involve? Is that just 24/7 sort of hotline, or a place where people can show up, or?
No, so what we're doing right now is we're working very closely with our community partners, many of whom are in the room today, and with our board, and so we are making sure that everyone knows where to go, who to call. We're referring a lot of people to our website where we're posting everything that we're giving out. So we're helping other facilities and partners plan and be ready, because a lot of people already have these plans available to them. We just need to make sure they know how to activate them, and that's the purpose of our incident management team at Public Health.
And I thought you made a reference this morning about the H1N1.
Yes, I was going to mention that.
Yeah,
So,
very effective.
yes, in 2009, we had an H1N1 swine flu outbreak, and there were a number of plans, procedures for that were put in place. We did things that limited the spread in the community. They were very effective. So we're using those and refining them and updating them as we go along. So it's, we had a base to start with, and we're just adapting it to this new virus.
One last one too, just for my colleagues also. Your names and if you could spell them, please, so we get it right.
Sure, Dr. Wendy Warren, WendyWarren.
Dr. Grant Niskanen, Grant, N as in Nancy, Iskanen.
And Jennifer Little, JENNIFERLITTLE.
All right, everyone, thank you. This concludes the press conference. I was going to say precludes, because I got the words mixed up.
Thanks, everyone.
Thanks.